Hello everyone, this is Dr. Swapnil Chandratri here. So today's topic is little bit interesting. The dentistry in India is in a declining mode. The only reason for that is because of there is lack of high paying job for the dentist, and the only way to earn a good money in future is either to do a masters or you do MDS or you open your own clinic. And even though you have done that, there is no guarantee that when and in after so many years, how many years you will be able to recover that money, because there are so many overhead costing and increasing in the rent and increasing in the inflation and all that. So that's why dentistry is in little bit in a declining mode. So that's why so many dentists and so many students nowadays are searching for the abroad options, that what are the options, whether they can do a good work or whether they can earn a good money and live a good life. So the most popular destination for this is generally UK and Canada. Most of the people are going there. They are paying lakhs of rupees of fees to get these side courses like a dental hygienist, or they are doing MBA, or they doing public health. And at the end of the day, still paying lakhs of money there, and still recovering that money is again a question, because there are also not good job opportunities after doing all those stuff. So it's like a loop nowadays, to where dentists are stuck and they are unsure that what to do, what not to do. So in today's topic, I'll be discussing about what is the possibility of a dentist here if they don't want to work as a dentist, and what are the other opportunity for dentists to work. So please stay with this video and watch it till the end, because there are some interesting information that will come regarding Germany. And if you haven't subscribed to the channel, please subscribe to it, because such information you will not find anywhere. So let's get. So the first option is very popular one, which is what I told, that people are going to UK and Canada for this. It's like you do some master course. Okay, so this master course includes this public health, MBA, MPH, and all that stuff. Now regarding these courses, these are a self-paid course. So whatever I have seen till now in Germany, whatever is self-paid, that means that it is not in a shortage phase. So for example, if you are paying for something, if you are paying for to study, that means that this thing is not that much required here. That is what I have seen by now, because there are so much of shortage in regarding so much of profession, and these professions are not they are not charging you to get study. So that is the first thing you have to keep in mind. And regarding these courses are generally 1.5 years to 3 years of time, and these are paid courses. So it's like the fees and the cost of living, and because of all that, the costing will come around 30 to 40 lakh rupees, because during that time your cost of living will also come. Generally with this type of courses, you get a student visa, 20 hours a week work permit also. So regarding that is generally these courses are full days, and get doing these part-time jobs are only mostly possible on weekends. And again, these courses are not joke. Okay, because end of the time you need to pass, you need to give exam to clear that course to get that certificate. So you need to study also. So if you concentrate on working, then you lose out on study. So because of that, many of the students are not able to get not able to cover their expenses, and end of the day, it's a costlier affair. Regarding the job opportunities, there are also English taught programs and German taught programs. If you are doing on an English taught program, then again job opportunities will be very much less. If you are doing a German taught program, then you need to first learn the German language, and then you can enroll into the program. After that, there are possibility to get a job. Generally these jobs are desk jobs. Okay, so it's like you work in some of the institutes, research institute, or academy or something like that, where you do all the paperwork and research work and all of the groundwork you are doing. So with that, the your salary comes around 2500 something in the range for the beginners, and slowly it might increase. But in a long way, if you have asked me that whether is it a good option to come to Germany, I will say that there are better and smarter options than that, because this is a costlier way. And also in the beginning, yeah, you might feel that okay, you have found a job or something like that, but in the long run you will feel stuck and in terms of growth, because it's like you doing a desk job or an office job, and you will miss your profession also, because you are you are not directly connected with the patients and something like that. So those are the things that come in the way, but there are smarter options for than this thing. So option number two, I will say, which is a better option, which is a dental hygienist pathway. Regarding that pathway, I have already made a detailed video that what is to be done and what is not to be done. If you haven't seen that video, please watch it. The link will come here. So basically, with the dental hygienist pathway, why it is better option? Because first of all, you don't have to pay any study fees. Not only you have to pay the fees, but you will get paid to get training. It's a training position. Directly you will be training. So half of the time you will be going to the school for theory part, and then half of the time you will be staying in a clinic to learn the practical part, how the dentistry and everything works here in Germany, and for that you get paid. So generally this payment also is in a range of 800 to 1200 euros per month. So it's also good enough to survive in the beginning. And once you clear this hygienist program, then you immediately get 99% you get the job at the same clinic when you are where you are doing the training. And generally this job starts from generally with approximately 2500 euros is your starting salary, and then slowly it increases. If you do some specialty, like if you are doing prophylaxis assistant, then you are allowed to do perio treatment also on your own. And here perio treatment is very much highly paid by insurance, so there is a lot of opportunity with that. And you can earn a good money. I have seen people earning around 3500 to 4000 euro per month, so that is also a good possibility to do. And if you want to do a desk job, or if you want to work as a hospital manager, so for that you don't need to do any paid course of MBA. You can do, after this hygienist program, there is 1 year of specialty regarding that, so you have to do that. It's a practice manager position, and in that you maintain the clinic, you maintain the staff, you maintain the patients, you do all the management stuff, quality management and paperwork and all that stuff. So you work as a clinic manager, and that way you also earn a good amount of money. It's in a range of 3500 to 4000 euro. So that's again a very good opportunity to go with it. And yeah, the rest things will remain, like work-life balance in Germany, and also those who like to travel, those who like to live a good life. Those all the things you can get to enjoy. So that is a very good opportunity. Instead of spending lakhs and lakhs of rupees in other country, and at the end of the day getting unsatisfied, it is better to enroll into hygienist program here. That's one of the possibility. Now third option is little bit out of the box, and it is little bit interesting. Here in Germany, it's a aged population. So in India, it's like most of the parents live with their children and they take care of them. But in Germany, it is not like that. Most of the parents they live independent. So and they, here the system is a pension system, so they generally receive the pension from the government. So for finances, they don't have to depend on their children also. And because of that, even though they have money, but they are not able to perform a lot of the treatment, a lot of the things in day-to-day life, and they have all of the needs. So generally here it's a very famous thing, which is a care sector, adult care sector. So in that care sector, it's too much of requirement of these people here, because there is a lot of shortage. and in that what you have to do is generally day-to-day stuff for this adult people. So for example, if they want to go to hospital, you provide that service. Day-to-day their medicine, you take care of their medicine, you take care of their health, you visit their home in between, and all those stuff you need to do. You are generally attached with some agency who are running this care sector, and you get their job. So that is also again a training position in this care sector. That it is same like a dental hygienist. You need to do 3 years of this training position, but in this care sector the pay is very high. It starts generally around 1300 euros and to 1600 euros. It's a range from the only training, and afterwards there is no limit for the growth, because you can work with some fixed agency, and with the salary basis also. And there are possibility that once you are working there and then you develop some good contacts, then you can work privately also, because here people don't have any problem to give money. They want just good service. So if you provide that service, in future you can open your own agency and all that thing. You can bring many people here. So there are a lot of opportunity in that region also. So that is a little bit out of the box, but with that you are related to with the medicine stuff. You are not completely out of the profession, that you are doing something engineering or something. You are not completely out of the profession, attached with the medicine, and still do something different but earn better. So that is also a very good opportunity here. If you want to have more info, or if you are interested in that, I can get you that position, and I can get you enrolled into that course. You can contact me. The link is in the description box as always. And yeah, these are some interesting options dentists can choose. Instead of wasting lakhs and lakhs of money and doing nothing and then confused about their future, it is better that you grab this opportunity in Germany, where there is a lot of shortage and a lot of requirement for these professions, and you can get attached with dentistry and medicine also, and you can earn a good money and live a good life also. So this is it for today's video. I hope you like the content, and as I said, if you have more questions you can contact me. The link is in the description box. Until then, have a nice day.